Yeah, ladies and gentlemen, welcome to this course, Biomedical Microsystems. I hope I am right and you're right here for that course. It's always a bit tricky the first week in the semester. Very warm welcome. Today it's more a little bit about the general terms and conditions and what you might expect here in this course. And the last organizational items before we then start full speed next week. So this course will be recorded. That's the reason why I have this microphone here around my ear. And we will try to upload the course afterwards as fast as possible. That could be probably Tuesday or something like that, so I don't rush back and put that up immediately afterwards. My plan is to start around 5 past the hour, more or less. So not completely sharp, not completely 15 minutes later, but all right, somewhere in between. Normally I tend to switch off the sound system here because this gives an awful echo if it's on. Either it's so it's not loud enough or it gives an echo. So hope you can hear me in the back. I'll do my best. And I like to start with some boundary conditions about the organization here of that course. There will be a written examination at the very end in the examination period. I should know the date. I already put that in the schedule, but I forgot to put that on the slides here, so I can tell you next week, or you check it up in the HIS-in-1 system. There is a kind of exercises or tutorial as part of this course. And if you pass the written examination and you pass the tutorial, then those two grades will be calculated together as the final grade. I know that some of you have very special opinions about our HIS-in-1 system that is for registration and handling you as a student with all your grades. I also have very special opinions about that system, but it's the only one we have, so we have to work with that. And I want to like you to check up if you're registered for the lecture and the exercises. That's one of the stupid things. So even though you have to take both, you have to register twice. Please also check that you have a proper working email address when registering, because we use this system to send notes out to you if whatever the university burns down over the weekend or whatever, we might send out an email to all of you that there's no lecture on Monday morning, or no, normally I try to get somebody else who gives the lecture if I'm traveling somewhere, right? All the lectures will be recorded. If there is whatever accident that this computer goes up in flames or whatever, we still have the old recordings from the last year. So you get a recording, probably not the actual one if something goes wrong, but you can listen to that stuff afterwards. It's probably just a little bit different in wording, but the content is the same. I'm more happy to interact with you than to give just a show here. Right? So if you have questions, I'm happy to take the questions, put them into the slides, and make a discussion with you. Because my opinion is it's easier for you just to go through the slides on your own. If we take more time for a discussion and have an important discussion here, if you have questions, if you want to know some details or whatever. Today we're a quite huge crowd. I'm pretty sure it will shrink down over the next 2 weeks, but nevertheless, want to repeat it again. I like to start about 5 minutes past the hour. Takes about 90 minutes. And I forgot the third thing. May come later on. Yeah, if you have a question, I'm really bad in focusing immediately. So the best thing is just to make a noise or wave your arm or whatever that I can focus, and then I'm happy to take the question. Otherwise, you might have to repeat it because I was somewhere else while talking. And I like to focus on you when I take the question, then it's easier for me. In most cases, I repeat the question that it's already well on the recording system, and then we can discuss about that. Those of you who are already familiar with the German bank holidays and the Southwest state here might be really looking forward to the summer term, because the summer term is mainly about holidays. So we have some holidays on Thursdays, and we have the week of Pentecost that is off, where there are no lectures, and therefore I decided to have the other slide. Here. It's always an adventure for me each and every term, because there are slight updates in the recording program that cause all the standard Office system to make funny things. So it might happen that I look a little bit weird and I see something on the screen that you probably don't see, but that works out. We have here, and this is something that we put on the Ilias system, where you get an email, how to access that, where to download all the stuff you need. Also put that timetable here, where you see that Richard Liljemalm is making the exercises. We have here certain topics, and there are certain tests. And I kindly like to ask you to make sure that you are there when the tests take place. Otherwise, no test, no grade, that stuff. If it happens that your grandmother celebrates her 100th anniversary, I'm pretty sure you know that in advance, that date. So please approach Rickard in that case, that we can organize something, right? If you become sick or whatever, it's good to immediately check if there was a test or not, and approach Rickard, that we can look for an empty room and another test for you or something like that. We we try our best to make things happen, but we need your support with immediate feedback if something goes wrong, if you have some problems, whatever. Because if you come very late, probably 2 days after the final exam or something like that, it's really hard for us to help you to come through. Right, that's about that part. Some words, because some of you might be interested about the final exam. We have at least 1 hour at the very end of this course to check out how it will look like, but I think I'm happy to give you some information today at the end of this lecture, that you have an idea how you could probably listen and behave through the lectures, but this at the end of today's lecture. All right. So back to the other part. Oops. All right. So now, since you have a very broad background from different disciplines, I think it would be nice if we could share a little bit about our opinions. So we can look from the humanities side, so more literature sciences on the word biomedical microsystems. Which component does it have? Biomedical microsystems. But we could also share our experience probably from previous courses, from your former lives before you came to Freiburg. And this is what I like to do now with you and to check a little bit and sum it up. So biomedical microsystems, does anybody already have heard about them? Any idea what could this be? Biomedical microsystem, or what it could be good for? Yeah? Yeah. And it's no, just to let you know, it's no right or wrong, it's just kind of brainstorming to see. How it looks like. Implants. Any other idea what biomedical microsystems could be or could be good for? Yeah. Any other ideas? Lab on chip. Right. Yeah. Say. Yeah. Diagnosis, okay. Okay, yeah.
Maybe like all the material aspects so that they can be better.
Yeah. Okay, I think that's good for that slide because you're telling me already some topics for the next slide. What I can see here are different applications. Can be either like lab on a chip, point of care, probably outside the human body. There are other things like implants that are definitely, per definition, inside the human body. We have already here some medical terms like diagnosis, right? So we want to get some data for something. And we have the material aspects together with the interface, human body, whatever, right? And so I like just to repeat that. What are they good for? So we have the diagnosis. That means to look for something. Does somebody of you have some ideas what they are good for, let's say in detail? What can we do with them? Yeah. So I'd like to challenge you. What would you say is the difference between a monitoring system and diagnosis?
Monitoring should be continuous and
Right. Yeah. So oops. Yeah, we go. Any other ideas? What are they good for?
prosthetics.
Yeah. What does a prosthesis do?
Compensates for loss
Yeah.
of weight.
Mm-hmm. You see, I'm sometimes a bit picky about wording. And I think that's important for engineering. And this is where I like to push you a little bit over the course to check the wording. Also, when we ask you something, I've slide in another course of this program here, that we really try to narrow down the wording very precise, because it helps us to define target specifications, right? For example, here in this case, if I would tell you, you should do something, let's say blood pressure measurement, because that's probably a medical measurement that everybody knows about a bit, right? So, and we would say we use it for diagnosis, then it's just once a time. So that's easy. You might know those cuffs that are wrapped around your arm. Pressure is pumped up, and then you measure that. That's fine, that's easy going, but that would not work if we would have the same system while you're riding your bicycle up in the Black Forest. It would be completely annoying riding your bicycle and somebody, well, an automatic system would pump up that cuff. And you could probably imagine if you would do it downhill on whatever, a scooter or your mountain bike down the Black Forest, and you have a sensor trying to measure your blood pressure while you're riding downhill, it doesn't work at all. I did not do it riding downhill, but in my former life I was some years a paramedic, and we had a beautiful new automated system in a medieval city with those bumpy gravel roads that are around the cathedral here. Imagine you riding a car on those underground and you want to do really sensitive measurements, and the whole car is bumping up and down. That doesn't work. So you need either an even more sophisticated system, or you just do it by hand, right? The old style, which you might know, that you take your fingers on your artery, the radial artery, and just measure it. And so we have a lot of target specifications that might come in depending on the application, if you take one or the other. And since engineers should be good at that, you know, cooking down the specs somehow, finding out what can the user intention be and how to mirror that against potential possible technology. This is something where I like to poke you a little bit. You know, that we come exactly to that language, cook it down. That's sometimes a bit annoying, I promise you. But it's important for you that you take this not as an offense, but really as an opportunity during your master program to learn with that, to be in science more scientific with the questions, but also with the answers. And I know that this is really hard, but we try to help you. We need your help, that you try to stick to that. And a nasty example is, for example, of course you would say, I would never do that, but I promise you, you will get into that trap. If I would ask you, what's the time? I want to have the time, right? I don't want to have the history of Black Forest cuckoo clock building. That's a nasty example. But there are other things where it can come to that point that the description of something, how it works, is not the answer to a question that goes more in the direction of why, right? So why? The answer is quite often not yes, because we do this and this and this and this and that, but there might be a question laying behind the obvious things. And this is something that is not easy, but we try to do it together here, probably by question and answering, and also in the exercises where we'll poke you a little bit more to the point. Right. So these are stupid questions on intention here, right? That we can come always back to those questions in all of the upcoming lectures and ask, well, what is the specialty here? How does it work? Why did people come to that solution, for example? And one question here now is, well, we have two. And one is, how do you think biomedical microsystems work? And the other that comes afterwards, and show it to you that we can split it up a little bit, is the question, what is the difference to standard MEMS then? All that stuff will get recorded, the notes are on, so you don't have to write everything, and I'll promise you, that's something I forgot at the beginning with respect to the organization, you get a printout of the lecture notes of all the slides, but I learned over the last gazillions of years that the system to register for that course is still open for another 1.5 weeks. And there are always some persons who are really late. And I neither want to have 200 printouts in my office, nor do I want to copy the last 5 for somebody. Therefore, I promise you, you get the printouts over the next weeks for that reason that the system is still open. I want to have the final number at the end, how many are here, then I can print 5 more and everything is set. But that varies, unfortunately, really over the first week of the semester, and therefore no printouts today, but later on. Okay, so back to our biomedical microsystems. How do they work? What are functions they might have? Any ideas? Yeah? Now I had to, I looked here and you say it again.
Biocompatibility.
Yeah, that's always right. What does that mean? So it's right, they should have biocompatibility, but what properties?
They should not misinteract with the body, or they should interact only in a defined way.
I like to phrase it defined interaction. What else comes to your mind?
They convert this biological component into a measurable.
Yeah. Conversion of
Be selective because the body is complex.
That's one of my favorite terms, selectivity. What could it include? Or if you would, selectivity is kind of desire, right? And if we now mirror selectivity versus technical target specifications, what kind of selectivity could you imagine?
To a specific molecule.
Like a membrane.
I call that target's fine for you? Right. I would have something else with selectivity, and that's the spatial selectivity in many cases, that you don't want to have the whole body as one point, but probably whatever, depending on the application, smaller volume, and the rest of the body could be then the unintended signal. As an example, it could be you want to record the electrical signals of the brain, and while frowning or moving your ears if you can, this muscle movement screws up the complete brain signal because it's a factor of 100 to 100 larger than the brain signal. It's both bioelectrical activity. It's both at the same spot. You probably might get it, but it's not what you desire or what you target. And therefore we'll see it. It's challenging. Probably also time. Sometimes you want to get something, sometimes you don't need it. And in most cases, you don't know in advance when do I really need it and when not, right? If you would have a disease where you have twice a day really increased blood pressure, you want to detect that, and probably you want to give some drugs at that point. You don't want to give the drugs all day long, because then you're lying in bed and are sleepy and dizzy because your blood pressure is always underground. And you don't want to measure with 10 kilo samples per second, 24 hours a day, because that costs a lot of energy. And if you have to store that, you would have to need a backpack or whatever with a petabyte hard disk to store that stuff. And that's the tricky stuff. How can I do that? How can I be flexible, on demand, patient specific, whatever? Well, first question would be, is that necessary or not? You know, do I need rocket science, or can I have something primitive? And the question, should it be as primitive as possible? That's a philosophical one, yeah? I don't know if you stumbled over that KISS principle, keep it simple, stupid. That's sometimes forgotten, especially in German engineers. We are really good on making solutions for things that are no problems, right? So that's always the balance, how to make it robust and reliable, and good enough, yeah? But what do you think could be, when we now compare things for biomedical applications with something else? Let's say consumer electronics, automotive. What could be a difference?
The material?
Yeah.
Application specific.
Yeah. Any other ideas? Yes?
It's highly regulated.
Yeah. I've seen.
Maybe like the autonomy, so you can have like operate somebody like
Yeah. Any other ideas? Size. All right. If you compare your smartphone with a cardiac pacemaker. Power, yeah, that's right. I would not like to recharge my cardiac pacemaker every 6 hours. Right, that was the word I was looking for. If my smartphone doesn't work, I just reboot it, right? If you have a life-supporting system, rebooting is not an option. For example, that was something that I, well, was not me, it wasn't my invention, but was kind of discussion group thing. We had something about life expectancies of newborns now. And in this country, or even in some countries here in that region, the life expectancy of a newborn girl is now about 81 or 82 years. And if you get born deaf, there's something like a cochlear implant. That is an electronical system that gets implanted into your inner ear. And by electrical stimulation, you can can excite the remaining fibers of the acoustic nerve, and thereby you learn a different kind of hearing. Ideally, you implant such a system once. That would mean, roughly, engineering estimation, rule of thumb, your electronics should last for 100 years. If we now try to imagine which other system is around with electronic components that last for 100 years or could last for 100 years, there's unfortunately nothing that comes to my mind, right? We are so lucky if our smartphone survives 2 years. Well, mine now survives 6 years. It's really so slow, and I should completely reboot everything because it's hard to make a telephone call with that old stuff. My amplifier at home is now 15 years or 20 and becomes a bit scratchy from the output amplifiers because they are halfway through, yeah. Probably we have an old fridge. If you share apartments here somewhere because it's a bit expensive, you might have some old fridges that are now 30, 40 years old, but need half of a nuclear power plant for powering because they are not that good. And then it comes really to limitation, right? So I once had an old radio transmitter with very old capacitors, the really old ones, you know, 2 layers of metal with 1 layer of oily paper, and the oil in the paper got rotten. I really had to throw it away. It smelled a bit like dead rats. So we have a problem, and this is something we have somewhere on the shelf or in the cupboard or whatever. If this would be inside a body, it's not a good idea that the capacitor gets rotten and gases out, or that an amplifier component gets just burnt somehow, then the whole system has to be replaced. And then the best of all of the imaginable worlds, the company would be still there and would be willing to deliver you a spare part that you can replace the implant. But there have been stories around the last 20 years where companies went into bankruptcy, nobody was around, the implant just came to the end of its lifetime, and patients were there left without a replacement. And this is something that's probably especially for your generation now entering the field where the expectations have been risen. Oh, it can work, right? Now it should work longer. This is a challenge where we have to look in some details. How can we make things robust and reliable if needed? You know, if you measure your fever twice a day, this could be disposable, that we just throw away afterwards. But if there's something that's implanted, it should probably last longer, depending on the disease, on the device, on the whole story around. And with that, I like to, after sharing a bit of knowledge and expectations, probably, I like to give you the idea behind this course. Because I had a certain idea, and sometimes it gets a bit lost over the daily work. I want to show you very different examples of applications of microsystems in medicine. So it can be diagnosis, treatment, rehabilitation. So diagnosis means to discover some parameters in the body. Treatment means I want to change something, where we have a common knowledge that this has gone wrong. So if there's pressure too high, one should lower the pressure, and we want to make it better. In rehabilitation, it's a kind of compensation. So something has gone, we have lost something, an arm, a leg, sight, hearing, and we want to compensate for. And in most cases, we are not good enough to replace that movement, that function completely. There are always discussions about enhancement. So can we all become superhumans by technical implants? You know, twice as fast. And you might have seen some of those beautiful persons running at the Paralympics with artificial legs that look like blades, or you have the same tendency to look lousy science fiction movies than I have. If you have stumbled over Kingsman, that lady with the sword-like legs, that's cool. But if you want to try to go shopping with those legs, would be a nightmare, you know? And that means we always have to ask, what is that good for? Is it highly specialized? Example, in the Paralympics, coming back from the movies to real applications, then it's good for running, yeah, for sprinting 100 meters or something like that. But it's probably not good for climbing a ladder, climbing stairs, walking on loose ground, something like that. And this is something that is very special for our functionalities. If you look on detail about our hands or legs, they are not that good for special purposes, but they are multi-purpose. So we are able to survive in unknown, varying environment. And that's quite often then the question, how can we do it like that? Is there a technical solution, or do we have to combine several ones? And therefore, I want to show you the examples, and since you will get a lot of techie stuff in other courses, mainly, my plan is more to get you an idea how the medical background looks like and how we can derive those technical specifications that we need out of the application to transfer it into a technical system. So I don't go in detail for each and every differential equations of the technical systems in that course. I want to explain the general concept then, bother you with the anatomical and physiological context. That means for you learning another language. That's one of the major challenges I experienced myself as biomedical engineer with a double E, electrical engineering background when entering the field. Your colleagues are suspicious because you're not a tough electrical engineer, so you're going somewhere into biomedical. Must be something wrong with you. And the medical persons are always very suspicious because you're not a medical doctor, you're an engineer in medicine. That doesn't work, you know? And therefore, the only thing how it can work is that you use the terms of both words, of both worlds. The pure, hardcore, dry engineering world and the soft, wet, bio world in the right way. And I want to help you a little bit, but that would mean that you also have to learn it like third, fourth, fifth language, you know, doesn't help. And then I want to go with you through those systems, and I've selected them in a way that they cover somehow, to my impression at least, a broad field of microsystems, principles, and of some fields I'm burning for. Yeah, that's master program, so the teachers should tell something where they're good at, not only the nuts and bolts. And at the end, there's always one slide that summarizes the lecture and one slide with kind of educational targets that give you a hint what you should learn by heart for the exam. Right, so that's a kind of hint what's the important part. I'm sometimes a lazy person. That means if I think that one application is really a good example, it could happen that this is an old example. And what I learned over the years is that the really basic, the first or second publication that has been published to a certain topic is quite often the best one you could get. Because in those days, when you are the first or the second one for a new thing, you have to convince all the others that your idea is really good. You know, if you come later as number 20, the community already knows, oh, that's really cool stuff, that application. Then you can be a little bit lazy with explaining things. And therefore, I have some publications which I'm referring to that are from from 2000 or something like that. Not because I'm too lazy to update everything, but these were then the original ones. And that's something I want to share with you, that the original publications are sometimes even before 2000. That means if you're entering a field in your master thesis, for example, it could be good to look back. When did it start? Was there a certain reason that it did not start 20 years earlier? In some cases, it's just that nobody had the idea, right? That's good. But in other cases, it could be that you need a certain level of technology or a certain level of societal agreement. When I started with my PhD thesis in 1993, there was an agreement in Germany, not written, not spoken, but a kind of background agreement. Don't go into the brain. That was something, was a good idea if you communicate with the general public to say, I go in the peripheral nerve. Oh, that's fine, doesn't matter. Say, I go into the brain, everybody was completely scared. About 10 years later, it was a hype of, let's go to the brain, peripheral nerve is so boring. Yeah, and things completely changed. And this is sometimes one of the reasons that things happened later or earlier. There were experiments in 1967 where a guy in Southern California put some electrodes in the brain of one of those fighting bulls. And they had those bullfights in an arena. And he went in there with remote control, controlling electrical current with those tiny little remote controls where you can fly drones nowadays, right? And he stopped this fighting bull half a meter in front of him. And the press release was, US scientists are able to brain control people. That was in the Cold Wars, where McCarthy was one of the driving forces in the US, and this guy had to resign. And the next experiments about that were 20 years later, just because of that press release. And therefore, it's really important to keep that in mind, that there are non-scientific backgrounds or informations or boundary conditions that can either promote completely stupid things or can block really beneficial things for the next 10 to 20 years because of some things that are hovering around in general discussions. But back to the overview. Today is the introduction. That is more storytelling about everything and nothing. To give you an idea, we already came somewhere from the back. Medical devices are highly regulated. That's right. And that's something where engineers are quite often not that happy with. Especially not when playing around at university. But I want to share some facts with you about the legal framework and the general classification of medical devices. And since you're coming from many different places of the world, I decided not to teach here a very special thing, very in-depth, but give you more a general overview. What are requirements? And this comes from the World Health Organization. So it's more an overview, and if you have that idea, then it might be easier for you to narrow down to a certain system. And worldwide, it seems to be that there are now 3 systems that are a bit different. It's the US system and the European one, and now they're getting closer. So the US took the advantages from the European one, and the European one overtook all the disadvantages from the US one. And there's a Japanese one, which I do not understand at all, to be honest. Sorry to say that. There are some specialities in there that are a bit harder to understand. So, but I think from the general terms, I will share something with you, also some personal experience when going into clinical trials in humans without having the idea of commercializing things, but for research questions. If you have the idea, can't we invent a new therapy looking on that mechanism, then you normally don't convince a company to immediately donate 50 million euros to you, but you have to prove that it somehow works before you go to the next step. And how to do that is the topic of next week. I want to go with you into glaucoma monitoring implants. That's pressure sensors, general pressure sensors that are somehow put into the eye to measure increased pressure in the eye, which is one of the main causes worldwide causing blindness. And this is pure MEMS. So all microsystems, but it's good to have an idea what is the challenge there, how to go, and what time frames are. The next two lectures then are some that are really go to the heart of my research. Neural implants. One lecture about neural implants to restore vision. What can we do to make the blind see again? And this is a kind of, I could also phrase it, flexible substrates and their survival rate inside the human body. So that's the question, how to bring things in that are more floppy than a piece of wood, and how to assemble electronics and what boundary conditions we have there. The week after is neural implants to record from the brain. That's for the silicon persons amongst you. So this is mainly cooked down to silicon micromachining and silicon probes that can be stick into the brain for fundamental neuroscience and for basic rehabilitation of highly paralyzed persons. And there are some pros and cons. The development started in, well, the first development was published in 1969. And it really became a success story in the 1990s then when microsystems engineering spread all over the place with microelectronics. The next one is then to relax a little bit, sensors in cardiac pacemakers. It's about the question, why should there be sensors in cardiac pacemakers? What do I like to measure? How can I do this? And is this simple and robust enough that I can sell it at a low price? No, I can manufacture it at a low price and sell it at a high price. All right? That's the business model. That's here about the very old publications. The imaging pill, there was a revolution about the year 2000 that people came up and said, can't we make a camera that I can swallow? And then my camera travels through my body and I collect pictures from that journey and can use that for diagnosis. Sounds a bit creepy, but the reason for that is if you imagine you would image your intestine because of some kind of inflammation. The usual therapy is to use an endoscope. And now you can imagine how far you want to have an endoscope from whatever side of the body inside your intestines. Right? And therefore, this was really a success story. However, it came out that the journey is so long to have a good resolution from the right part of the body, depending if it's about the esophagus, it's about the small intestine, the large intestine. There might be an opportunity that you switch on your camera later or switch it off earlier, whatever, depending on the distance you want to image. But there are also some general requirements. You know, the stomach is really a very harsh environment. We have pH 2 in there in the worst case. If we go further down in the large intestine, we have pH 15. Acidic, basic, so really challenges. It's dark inside. Normally you have not an empty tube. The question how to get those pictures, and if you see something that you have an inflammation, how do I know where that is? I can say, oh, it's inside the body. Doesn't help for surgical intervention, right? You want to assign it somehow, and the question how to do that is topic of that lecture. Since this is already camera, the next one is about optic measurements, spectroscopic measurements of bilirubin. That's newborn jaundice. So you might have heard that if somebody got children in your environment, the more proper they are and the heavier they are, the more they're prone to that yellowish color popping up one day after birth, because the liver is not already up at speed, and the red blood cells die, and there are some residues, and there's a strong dispute if this is neurotoxic or not. And the question is how to measure that in a way that it can be done in each and every district hospital, having different hygiene situations there without cross-contamination at a short time and whatever. And there's probably I should check it up again this year how this device is now called, because there was a huge rush the last years. One company bought the other. That's a kind of sports that if products are good, that one company buys the product of the other and they exchange products, and so I lost a little bit track about the actual name of that product. We have to check how long the semester is depending on all of those holidays. Trends for intelligent endoprosthesis, that's something that can be probably skipped, probably it's in, still dependent. If not, I tell you stories sidewise about that. We have stability and functionality of implantable MEMS that comes together with packaging and housing concepts. So the question, if we are inside the body and if we want to have long-term functional reliable systems, what does our body do with the MEMS? Normally, you have them in a package. If you look at your smartphone, there's some video clips that you can drown them in the sink or in an aquarium, whatever, for a certain period of time. That means they're watertight. Most of the other electronic circuits are packaged in a way that they're watertight. However, if we want to measure something, and I don't mean temperature or pressure, but electrical signals, biochemical agents, we need direct access between the sensor surface and the target. And therefore we need a concept that the sensor is not toxic for the target tissue, and the target tissue does not eat up our sensor. There's a new trend about biodegradable implants. Then it's a desired feature that the body eats up the sensor you have in. That could be for infections or whatever, where you know the infection lasts for a week or two, and if your body eats up your implant over 3 weeks, then you're fine. Normally, in a cardiac pacemaker, you don't want to have the cardiac pacemaker being eaten up, right? And it doesn't help you. The heart does not recover in that case. And we have to check a little bit what is done in standard cleanroom processes, which is good then for the standard process, and which challenges might occur, and is there an opportunity that we can overcome those challenges? And probably looking in other disciplines. What are they doing? Can we borrow some ideas? Can we transfer them? That is the idea of that. I learned in the first years of that course, due to different background knowledge that you bring into the course, that it could be helpful to summarize wireless data and energy transmission. That's the reason why this lecture is in. Since implants or also non-implantable medical devices somewhere on the body, you want to talk to some other stuff, like your fitness app on the smartphone or your health insurance. Probably you don't want to talk to them, but your health insurance want to talk to your device. There have been strong disputes, for example, can therapies be more efficient if you would have sensors inside assistive aids, for example? And there was a strong dispute, at least in Germany. Well, if I don't go to the physiotherapy and don't train well, my health insurance could read that. and probably they refuse reimbursement of the therapy. And this is probably a stupid thing, but there's a lot of discussions raised now with respect to privacy. Privacy of data. Am I still the owner of my brain signals? That is the latest discussion. What if implants go beyond medical therapy? You might have read those things that Ritalin is supposed to boost your short-time memory, and that there has been some years ago very provocative article from Ivy League universities in the US claiming that Ritalin should be given free to all students of their university to re-establish equality in exams between the students. That was very provocative because they said, I want to have all my students taking drugs or none of them, right? And there are now some studies claiming, just that you don't get it wrong, don't take Ritalin because it does not help you to think better. It's just a kind of niche enhancement, but the general level of intelligence drops down when taking that in examination situations. But the question is, if I would have an implant that could do whatever, there's from the US military a study that's guess nearly finished where they ask, can we suppress anxiety in soldiers? And would that be better for them sending them out to the battlefield if they would have less anxiety? Or would they die earlier because they are no longer that careful? But playing that, and I don't want to start a discussion here if this is good or bad. I have my very strong opinions about that. But rethinking that could mean if I would have an implant for another foreign language or boosting whatever capability, I could be probably selected in a job interview over a person who just has his or her normal brain. And can I read that out? Even not hacking the implant, but could I have probably a small transmitter under the office desk that blinks green if my candidate has an implant, just for some interaction that I measure, or red if the person does not have? What about that? What about privacy there? Huge discussion all around the world now since 5 years about that stuff, where the discussion is somehow a bit decoupled from the technological feasibilities, whatever, but I think it's good just to have that idea, where do I want to go with the society I'm living in, and what is my personal no-go, and where I'm opting for, right? And therefore I think it's good to share at least the basic common knowledge about wireless data transmission, energy supply, a bit of coding strategies and pros and cons of the coding strategies. How many data can I transmit? How does it work? Something like that. And then at the end, at least one lecture to summarize everything and try to give you useful hints for the written examination. And as I promised, I want to start today with commenting on that. This is really broad, right? So it's not like microelectronics part 2 or whatever, where you use that technology and probably another technology. This should be more an overview lecture. And some of you might say, well, I'm here for learning VLSI electronics. I hate that biomedical stuff. That's fair. But nevertheless, we want to force you to that course. So it's one of the mandatory ones in the Microsystems Engineering Master's program for certain reasons. And one of the reasons is that medical devices are one of the stable growing areas in technology. And that means it could be good to have an idea about the mechanisms behind and some applications. And a lot of technology is used in there. So there's optics, there's electronics, there's packaging. And whatever survives in the human body can also survive as harsh environment sensor in a car. So I think there's a lot of transfer option that can be given here, and therefore we decided to have this as a mandatory course. And even though we are all now in the whatever Internet of Things and Industry 4.0 and however this is termed, and how fast whatever transmission rate is, we all might have experienced that we get news or statements where we need some solid knowledge to know, is this true? How can I judge this? How to assess it? And therefore, and since I'm a little bit older than you, I'm a strong believer that everybody should have a fundamental knowledge outside the internet. So we should have some kind of anchoring points as knowledge where we can assess what that additional information from the internet brings us. And therefore, that was the polite introduction to say the examination is without any technical aids. The reason for that is that I believe that those anchoring points of knowledge should be around. That means on the other side, you have to learn some numbers and technical terms. On the other side, you can use your knowledge from other courses to bridge that and explain things. So more an integral approach of that course. And you will see in the different lectures what I mean. But therefore, we also have structured our final exam in 3 parts. One part is really about facts. So 1/3, it would be a kind of multiple choice test, but we have an examination order of multiple choice tests that brought it on the back page of a journal for ironic texts. So it's so weird that I decided I don't want to follow that examination order. Therefore, it's not a multiple choice test, the first 30%, but it's a question and you have to write down one word, yeah, for example, or you have to write 4 words. So what is, please order the 4 terms according to increasing resistivity. Yeah, something like that. So that you have those basic knowledge. Part 2 is what you expect from a written examination. So there are some questions and you have to answer. That's mainly bringing the different things that you learned more or less one-to-one down in your own words on a piece of paper. Third part is something you should learn on the master's level, and this is the transfer task. You get an unknown problem, technical problem, and some questions to that problem, some information. No, wrong, some text, and you have to find the information. That's different, right? And then some questions where you should solve those problems in the questions according to your knowledge you acquired here and in other courses. Could be, for example, something that will not come, a valve draining the brain when you have overpressure in the brain, and some questions to that. We have not done that here, but we have glaucoma measurement, then you know about pressure measurement already. We have had materials that are in contact with the body. We have had legal boundary conditions, and there could be some questions around that. So it's not completely blue sky, but is applying your knowledge that you learned for different problems. Most of you might already have browsed through all the lectures and topics that we have. For those of you who are burning for whatever life science applications, we have further courses that we offer here as kind of concentration. There's one concentration, life science / biomedical engineering, that goes more towards electrical signals and implants inside the body. And we offer some courses there about biomedical instrumentation of amplifiers, so all the electrical signals. We offer biomedical instrumentation with respect to imaging, that to give you an overview. We have now physiological control systems, electrical stimulation, implant manufacturing technologies. There are seminars about neuroprosthesis. There's neuroprosthesis and ethics, and a lot of other stuff that I don't know by heart. The only important thing is, if you like to enter that concentration, as each and every other concentration, check during the next weeks probably what could be of interest for yourself, because sometimes there are some prerequisites, not only in the concentration I'm responsible for, but also in others that you don't recognize at the end of your course program. Oh, I should have participated in something 1 year before, right? Normally I would say it doesn't matter, whatever you participate in is good for getting whatever outstanding master topic later on, but you should make your mind and select those things where you're most burning for. Colleague Roland Sengerl is responsible for Lab on a Chip. That goes more into bioanalytical diagnostics, point of care, polymerase, chain reaction, microfluidics, all that stuff that's really chemical and biochemical. That's situated there. Question is always, what book should I read? The honest answer is I have no idea. There's so many books and they are all exciting, but it's really hard to find one that exactly covers that course, because this is really somehow tailored here to that place, that it fits well to the other things. A relatively old book that covers kind of that stuff is Gerald Auburn's Bmms book that should be here in the library. So if you're excited about topics like that, just browse through the library. There are some books standing around. We have bought a lot of ebook access the last year, so you can download a lot of ebooks here. There are even ebook readers here, or tablets that you can borrow from the library if you don't want to use your own one or you don't have an own one. So there are plenty of options. Just go over in the second floor here, make your mind, have a look and see what's around. There are also a lot of international journals around. With your university account, either using the tunnel or being in the university network, you have free access to them. So that's a good opportunity. If you're really excited about a topic, whatever, you can go into browser, into search machine and try to get it. If you find something for your later work, that's probably not your burning question of today, but you might have read it somewhere that the publishers are getting crazy about the money they want to have for access. That's ridiculous in many cases. We still have, just to give you some numbers, IEEE journal access costs us about 77,000 euros a year. And that's not amongst the expensive ones. And therefore, the universities try now to negotiate with some of the publishers. But that means it could happen that you have no access to a certain journal. If you desperately want to have that article, just go into the library and you get that article via PDF for free. Because we decided it's cheaper for us. It costs us €1 to order that. And having is now via the internet and email just takes the official librarian access to that. It's easier to supply everybody with articles than buying the fees for the journals. Well, we have probably 3 downloads a year and paying 10,000 euros for that journal, right? So just as a feedback to you, or just as an offer, if you need some journal articles and they are not freely accessible, please go to the library and there's an opportunity to get them for free. Good. So that was the main part. Small homework for you. The basic setup of the course is done, right? So I cannot completely change it from now to next week. That will be too much work. Usually it takes about 8 to 10 hours for a single lecture to prepare something like this if you do it for the first time. Sometimes even longer. But if you have the feeling, I would love to have something in addition to that, please let me know. And we try. So we have, for example, you might have seen that cochlear implants are in the exercises. So if you have something where you say, well, this is such a cool thing, I want to have it here, and I think it's so important for all the others that we learn about that and discuss about that, just let me know. And I'll try to squeeze it in somewhere, or to cut out 20 minutes from something that can be done faster, to put it in. But I need, in these cases, your feedback. All right. With that, I'm at the very end for today. Thank you very much. If there are any questions, I'm still here for some minutes afterwards. So I'm happy to give you feedback on easy things. If it's not that easy, we make an appointment and take our time to make it in detail. Thank you very much.